Brilliant. Hello. Hi, everyone. Welcome to another episode of Holistic Vet Sisters. It's 6 o'clock on Thursday, UK time. None of us are in the UK, so we have to really remember to be here on time. Yeah. Don't we? At the moment, anyway. Tonight, none of us are in the UK. And yes, I look like I'm being blown about by a fan because I am. So just ignore that for the whole of tonight. I will look a little odd. It's very hot where I am, but it's wonderful. And I'm so blessed to be working with Pawsome Raw, which is an absolutely fantastic raw feeding company out in Cape Town. And they, to my heart, use organic free range, grass-fed, pasture-raised meats, which is just amazing. So super pleased about the quality of their food. And they are also running the African Pet Health Summit, which I'll tell you a bit more about next week because the ticket website isn't even live, but and I don't think the actual website is, to be honest, but it's very like the Natural Dog Expo, but it's for here. So yeah, really excited. And I've been helping Rikke to create this a little bit, although she doesn't really need my help. She's so good. She's so great at it anyway. But yeah, it's nice to be involved. So anyway, we are here. We have loads of questions. We really hope we get through them. I'm here, as always, and with Dr. Lise Hansen and also with Rikke Schultz. And so you may remember Rikke has been on previous Holistic Vet Sisters, and she specializes in fascia, and using fascia in a holistic way to support your dogs and cats and horses' health. So welcome back.
Thank you.
Good to have you back.
For having me. Nice. And you're sitting there and very hot, and I'm in the cold, as Lise, cold Denmark. Being
yeah, it's very cold.
Yeah. So yeah, it's in each end of the scale.
Absolutely.
Yes, yeah. Shall we start with the question from Molly about her Dachshund's IVDD, because that is totally a question for you. I mean, it could not have been a better week, really, for Molly to ask. Shall I read it out?
Yeah, please read it.
Okay. To go back to the question. Right, so Molly is asking about her 7-year-old Dachshund. He's had his first episode of type 1 IVDD when he was 5 years old. She's hoping for ways to help prevent further episodes and support his back and joints holistically. He has supplements of omega-3. He has a medicinal mushroom blend, and he also has velvet antler from elk, New Zealand elk. Now, Molly doesn't write that he is raw fed, but I suspect he is if she's gone to the lengths of using medicinal mushrooms and antler powder. I would say this is not a dog that's on kibble. But Molly, if you're watching, maybe you can comment that just so that we can confirm that he's having fresh food. Even if he's having fresh, lightly cooked, that would be really the way forward for him, beyond what Rikke will say about this question. What do you think?
I was just thinking, I just got the question to hear the question now, that this dogs really often have almost a contraction of the little muscles along the whole spine. And it's very important to release it, to give space to the vertebrae and they can open up. One way which is really effective is acupuncture. That's can really help them. Another thing that then you would do local points in the area, and you would do distant points. And you also could use, like I have been talking about the myofascial kinetic lines previously, and the line that's called the deep dorsal line, it's running in these little muscles just around the vertebrae. And treating that line would be also very effective to take some pressure off between the vertebrae. So acupuncture is a really beneficial way of treating these dogs.
Can I just say, because two things. First of all, IVDD, if anyone doesn't know, means intervertebral disc disease. So we're talking about, yeah, discs, long backs and disc problems. And the other thing, because most of the questions that we get go into the most of you are direct messaging us. This was a fairly brief question, but I have just posted it in the thread so that everybody can read the question, because that makes it a little bit easier to follow what we're answering, I think, if we can see the question.
Yeah,
So I hope
That's a
that's
really good idea. Yeah, I
Yeah.
think that's important. I know it's sometimes easier just to message us, or maybe people like the idea of anonymity, but actually it would be better to have it, everybody can see and know what we're answering.
Sure. And I mean, I haven't given anyone away, but I've just copy pasted it, and it's from Molly, and put it in the thread so that the question is there.
Brilliant.
Anyway, yeah.
Lisa, do you treat any of these dogs with homeopathy
I do.
as a supplement?
I do. I mean, and sometimes homeopathy is amazing for locomotor symptoms, you know, for arthritis or for slipped discs or any kind of symptoms from the locomotor system. Is just not the first thing I think about, I would say. I treat them with homeopathy, but then I also very often refer them to you, because you've got these other skills that are also very, very relevant in this context. But it depends, as always, it depends on the symptoms in each dog.
Definitely.
You know, you can have an acute, sudden onset, very painful slip disc, or you can have the slower type 2 kind of herniations where the pain is slowly progressing. And I do treat them, but I wouldn't only treat them with homeopathy. I would also refer them to someone with you know, I tend to view them as whether you're talking about, I don't even know what words you're going to want me to use and not use, but you know, whether we're talking acupuncture or osteopathy or chiropractics or fascia work or craniosacral, but you know, someone with a better understanding than I have of the tensions and the muscles and all of that is definitely not in my skill set. So I think it's not a matter of one modality that will do all of it, but homeopathy can certainly be on the list, and it can certainly help, but together with other things, I would say.
I totally agree that these are some of the diseases that are quite complex, and you cannot only do one thing. So I would do acupuncture, manual therapy, but then if it's a like chronic onset, you might be good to look at the patient from a homeopathic view too, to release whatever they have, or with the food, whatever they eat, to try and help them not being too stiff in their fascia.
For sure, the food is important. I mean, I would guess that this dog is on a fresh diet of some kind, but I mean, it is vital though. I mean, the published studies have linked the microbiome to inflammation and to pain, so it's incredibly linked. And also, if there is an imbalance in the gut, I mean, it depends where in the back this IVDD has shown, but the cerebrospinal fluid is like a two-way communication between, as you know, between the organ underneath and that point in the spine. So there is information being passed between. So it either can be that the problem with the IVDD is creating or contributing to something within the organ that's linked with it, or the other way around, the organ linked with that part of the spine, that vertebrae, is actually creating or contributing to the issue with the IVDD. So either way, it's worth speaking to a vet that understands about that line of communication. And if it is near the digestive system, then definitely we want to be thinking about how we can improve the microbiome and improve the diet.
Yeah, I have a personal experience, not that I'm going to sell myself here, but still, that I don't know how that is in animal, but just like for me, if I can't tolerate milk, and if I do drink milk, my quadratus lumborum, and one of the back muscles, gets so tight, and I get a terrible back pain. And as a kid, I didn't know I couldn't tolerate milk. I had always a stomach ache, but I also had back pain, and I was like this in my pelvis and my whole back, as like for many years, until I stopped drinking milk. So I can so relate to what you're saying, that it's so important, like the gut health can mirror problems in the spine. So
And an intolerance as well
yeah,
can lead to a muscular issue,
exactly.
or what we just think we've got a stiff shoulder or something, and actually it's because whatever we've eaten, it's not that it's gone down and then set a pattern across in the blood or the lymph. It's literally affected the cerebrospinal fluids communication between the vertebrae and the joints, and I find that fascinating. We just
really.
So many of us have that, and we will learn more about that in April in the UK.
Super.
And I suppose what it is that it's partly, I mean, a dog of that type with back issues is partly a mechanical thing, isn't it? It's partly a confirmation that is unfortunate in that we bred these dogs, but it's also inflammation, and inflammation can be treated from lots of different angles to reduce the inflammation involved with that. What will be your go-to? What do you find the most useful, like in patients like this? I mean,
it would be definitely acupuncture first, because especially if they are more acute, because then they can have a lot of inflammation, and then I might not want to do manual therapy, osteopathy on them. So I would definitely always start with the acupuncture, because that gets the blood flow going, remove some of the inflammation, and then you can see if you can do some light manual therapy. And sometimes I don't even do that. Then it might be mainly the acupuncture, like in traditional Chinese medicine, and also combine it with the fascia work that we do, because that is so important too. So that would be where I start, and then next time maybe I can do some more manual therapy, and then I would look into the other stuff too, like the homeopathy and the food. So that would be my row of order.
So that's a very nice, clear message to Molly, is to find a vet who does acupuncture in your area. And the place to look would probably be the IVAS website, IVAS, International Veterinary Acupuncture Society.
There is a
probably.
British one. There's a British one. There's a UK British one as well. It's something like ABVA or something.
Yeah, that's also one that I wouldn't necessarily recommend, but yeah.
Well, no, you know why? Because they're not all TCM trained.
Yeah.
But they can cope with this kind of mechanistic
this approach. They can do. It's more biomechanical, from a biomechanical point of view.
Sure.
And you can get far with that one too. Yeah.
But if there's someone trained through IVAS, I would choose those though. If they have it.
100%.
Yeah. But that's certainly a step that seems, if it hasn't already been done, that would be the absolute first go-to for a dog with this type of problem. Yeah. Good. Nice to have that's what you need to do. Get going. Go. Run out the door. Find an acupuncturist.
Don't listen to the rest. So I just quickly, a couple of quick ones. Claudia's asking if a dog can still have garlic while he's on heart meds.
I didn't get that.
Can the dog still have garlic when he is on heart meds?
I
heart medication. I'm not aware of any contraindications in terms of garlic and heart medications. That's not something that's on my radar. Have you heard of that?
No, I don't know. I must say it's not my table here. So, but I haven't heard about it.
I mean, I did sort of look it up because which we obviously don't normally do. But I mean, of course, you just get the vets that say that they mustn't have the garlic. So it's a difficult one to answer, and I guess the best thing to do, what I suggest you do, is speak to a veterinary herbalist. Ask them. They will know instantly. So maybe we save that question again for when we have Vicky on or somebody similar.
But also my counter question would be, why do you want to give your dog garlic? I mean, it wouldn't be the first thing I would do to a dog that comes with heart disease. There's lots of other ways that I would want to approach heart disease. Garlic wasn't on my list, really. So I wonder why you want to give your dog garlic. And then we're maybe, I don't know, back to that sort of thing that we talked about often, that there are some things, turmeric, garlic, whatever's in fashion, that everybody's giving their dog because it's good. and would always want to deter anybody from that approach. You know, garlic is not fantastic for everyone. I'm not a fan of giving dogs garlic, but that's because I'm a homeopath, and it doesn't go well with homeopathy. But I'd rather have the dog on homeopathy than on garlic if it has a heart condition. Absolutely. So I would question the need for garlic, but I'm not aware of any problems alongside heart medications. But can't swear to it. Never heard about it.
I think that's actually a very good point, because garlic does get sort of seen as we must give it all the time and then they won't get so many fleas or something like that. But I am a big fan of using garlic when you really need it, because it is such a powerful antibiotic. And if they're having it every day, would it then have the same effect when you really needed it? That's the thing.
But this is the conversation we always have, but I think it's worth mentioning it again, because it's such a good point that there isn't anything that is just good for everybody in every context. You know, that's just almost never the case. You need to be more targeted in terms of what we're going to give this dog in this situation. And if heart disease is the main complaint, then I'm not quite sure I understand the desire to give garlic.
Okay, so the other question is, there is a golden retriever. I think he's sort of, I should know this, but possibly he's like 3-ish, 4. Hope I'm getting that right. It's one of my friend's dogs. So I just heard on the grapevine she was thinking to give him HRT for something, possibly a weight. No, it's for the luteinizing effect, hormone effect. This is why I said I'd ask you. Sorry, I haven't written this down properly. So you know this luteinizing.
This is a neutered dog, presumably.
Yes.
She's neutered him and regretted it. Was it a he?
Yes. So anyway, she was considering HRT, and I said, let me find out first, because that's quite a big drug, I think, to give the dog. Is there a different way we could be approaching this with the view of the luteinizing mitigation? So I know that's a huge subject, but is there a different version of HRT? Can we do it herbally? Can we do it homeopathically?
We need to know what's wrong with the dog. So it's a male dog that's been neutered.
More just a question of, she's going to do this anyway, so I just wanted to find out, surely HRT could be created herbally or in a homeopathic way.
I would say it's a very controversial area, and it's an area where we're only just beginning to learn about this. It's still very, very new that neutering is as harmful as it is. And personally, I'm going to try really hard not to offend anybody, and I apologize in advance if I fail. But there is a tendency for sort of fashions in everything, including in what we do. And there seems to be a lot of focus at the moment on HRT for animals. You know, all the neutered animals need HRT now. And I'm concerned about that. I think we've made 2 wrongs don't make a right, and we just don't have the evidence. We don't know enough about it. You know, just because you have a castrated male dog doesn't mean that you should now go and supplement with testosterone. I mean, we just don't know what we're doing. We don't have the evidence for what it does. It may make it even worse than neutering him did in the first place. The world leading expert on this is an American professor called Michelle. She's either Kutzner or Kutzler. I can never remember if it's an L or an N, but she's the one who's leading all the research, and she's one of the authors on the WSABA report on neutering. And I very much would follow what she says in this. And she says, if you have an animal that's been neutered and the animal appears healthy, don't do anything. We don't, you know, just stay clear. And if the animal does develop symptoms that you suspect come from these chronically abnormal LH level that all neutered animals have, then experimentally what they're doing is they're treating it with the chemical castration that we're normally using to, you know, chemically castrate male dogs, because the way that works is that it lowers LH. So there is some experimental work saying that if you have a sick animal that was neutered and you think it's sick because it was neutered, that's the hormonal treatment that we actually know may work. But to say, oh shit, I neutered my dog, I regret it, and then start giving the males testosterone and the females estrogen in artificial levels with no evidence to back it up, if they appear healthy to begin with, I'm very concerned about. But it is something that's in fashion, and it worries me a little bit, to be honest. I would not do anything at all. I think HRT to a healthy dog you're very much at risk of putting another wrong on top of the one that was already done if he is clinically healthy. I think in terms of neutering and the harm of neutering, my focus is much more at the moment on, first of all, spread the news so that no more dogs are neutered anywhere at all. And secondly, if they become ill, how can we use this information to understand better why they're ill and how to treat them? But if they were neutered and they're healthy, I'm concerned about this desire to hop in and do more stuff that we don't quite understand the consequences of.
I think that
That's
is
my take on it.
absolutely fantastic approach and way to describe it. I was because I kind of thought, wow, like maybe my friend doesn't realize quite what HRT will do. It's like, oh, just give him that. Like, no, you know, this is quite a big thing, even for someone.
But it's very in vogue. I mean, there's a lot of American holistic vets who are very keen on making this their new big thing, and it'll be really interesting. I may say something completely different in 5 years. I'm just a little bit concerned about us overreacting now and doing more harm because we still don't quite understand what we're doing.
Yeah, exactly. I think, and possibly the traditional vet has mentioned it, so you know, it just is something that's on the table. Well, anyway, that is definitely the answer for that for sure.
But I think that it's a really interesting point that we can that the chemical castration for male dogs works by lowering LH, so could end up being the treatment for sick neutered dogs, male or female. So you first castrate him, surgically, then he gets ill, then you castrate him chemically because it actually can solve the problem. That's bizarre, but that's where the research is at the moment. But we just have to wait and see. It's too experimental for my taste. I'd rather leave it, let it be, and unless we really understand what we're doing.
Right, okie doke. Let us move on to Sue's question about her very sweet looking dog, which I will show you.
Let me copy that into the.
Isn't the dog lush? Very nice coat there. Presumably raw fed. Layla, her name is, because I'm only saying that because she doesn't really have any tear stains. So let's start at the beginning. So Layla, 6.5-year-old Shih Tzu cross Maltese. Don't know what you call one of those. A Maltzu I'm going for. So she's a Maltzu. She has been neutered. We have always fed her dry food. I must have missed that bit. Recently, she had blood in her urine confirmed by a vet, which was about a month ago. Obviously had antibiotics then, which made the bleeding go away, but it has since come back. Yeah, because they don't solve the issue, do they? So she had a lab urine investigation, and the results were moderate struvite crystals and marked microscopic hematuria, but no evidence of UTI. So the vet has offered Hill's prescription SD, which is very common for this kind of diagnosis, and encourage water intake, ironically, given that the dog is being told to have dry food. As a nutritionist, this is why we love fresh food, because it provides the water that they need all the time, not just when they're poorly. And also has suggested considering an ultrasound, which of course would be the next thing that the vet would do. So my question is, Sue's question is, can we help Layla to recover more naturally with higher protein and supplements rather than change her food altogether, which would be switched obviously to this SD? The bleeding has got better. It is not all the time, so it's intermittent. And it's more if we go on a longer walk. So maybe something to do with skeletals and fascia, Rikke, I don't know. Because she wants to wee to extreme levels on everything she sniffs, which is very normal, isn't it, for the little dogs to do that. She doesn't appear in pain. So I will just start with, I think it is going to be way easier to switch the diet than you think, Sue. Honestly, I mean, if you want to have a consult with me, just because honestly, we will be sick for 45 minutes and you'll come out and go, why did I not think of doing this years ago? It is way easier than you think. And I can support you if you need to do it economically. I can explain how you would do that. So yeah, I would say a dog that has these kind of symptoms, it is like the bottom line is they need to be on fresh food. So if you can't manage raw, then we can look at lightly cooked if you don't want to be feeding raw. But this dog, these symptoms won't have just arrived. These will have been building up and will be related to the type of diet and what I call the nutritional elements in the diet, like the moisture content and the biome and that kind of thing, not even necessarily talking about the vitamins, minerals, that kind of thing, or any kind of deficiencies. This is about the type of food, really. So definitely I can help you if you want me to. Message us back on this page about that. But that, I mean, I think beyond just saying that, I think we talk about other ways to help Layla. But I think the other ways aren't going to work as well if she isn't having a moisture-rich diet with a vital life force flow in it.
Yeah, no, and it just, I mean, it's just very intuitive, really. I mean, this is about the urine and it's all about hydration. The more flow you have through your system, it's about, if she's dehydrated, it even says concentrated alkaline urine. Concentrated urine means your dog is dehydrated. And it's not a surprise that your dog is dehydrated because she's fed dehydrated food. So if she has to not only drink a normal amount, she has to drink extra all the time to catch up because her food is lacking in moisture. So even just on that very, very kind of mechanical, practical level, she needs more fluid, and the easiest way to get the fluid and the most natural way to get the fluid is through the food. So I agree completely with Caroline that I think feeding, I mean, I discussed it at length in my book, but I discuss it in the chapter on cats because this is a more common issue in cats than it is in dogs to have an inflamed bladder without a bacterial cystitis. This is what typically happens in cats, and it happens only in a minority of dogs with bladder inflammation or infection. But hydration is the key. She needs to drink as much as possible, and you're shooting yourself in the foot by feeding her dry food because then she's just behind on points in terms of drinking enough from the outset. I would also just comment, maybe a little bit unusually, that I think your vet could, it's almost a little bit sloppy. If I read it correctly, she had blood in her urine, and the way I read it, they then put her on antibiotics without checking the urine, which I think is not great practice. I mean, there were presumably, I mean, we're guessing now, but if there were also not bacteria in the urine at that point, then that was clearly the wrong thing to do. But we now don't know if there were bacteria in the urine at that point because she had antibiotics. The bleeding went away and came back. And then they said concentrated alkaline urine with moderate struvite. And they are considering ultrasound. I think they should do an ultrasound. I think it's a little bit neglectful both to give antibiotics without checking whether there are bacteria first, but certainly to have an unexplained recurring blood in the urine and not know why. I think ultrasound should be done. I think it should be done now. There could be a tumor in the bladder, there could be polyps in the bladder, there could be some sort of, I mean, there could be all sorts of things going on in that bladder, and you don't know. There could also be stones in the bladder. There could be struvite stones in the bladder. And I think, so I really would recommend an ultrasound scan just to know what's going on in that bladder, and then you know how to approach it. So I think you need a proper diagnosis. I don't think putting them on the Hills diet is the first thing I would do, but I would want to know what's going on first of all, and why this dog has an irritated bladder. And then once we know that, it can be treated with a better diet, better hydration, maybe, you know, finding the best pH for the urine, but maybe just making it more dilute is enough. Maybe homeopathy will be indicated. It depends what's going on. Maybe it needs surgery. If there's stones in there or polyps in there, but there's something that's bothering the wall of the bladder and we don't know what. So I don't think that we can even discuss that in an informed way without having had an ultrasound.
I absolutely agree with both of you. But the interesting comment was that it gets worse when it walks for a long time. And it's very important to understand that all the organs are hanging in fascia inside the pelvic region or the abdomen. So if an organ has a problem, it will manifest out in the musculoskeletal system because of the pull from the fascia. So that's, I see that's very common, like here when we have cold winters, especially geldings, horses, they have lumbar pain and they stop when the rider is riding them and they want to pee and they can't pee, and then they will go on for a little while and then will stop again and try to pee. So there's definitely a huge correlation between lumbar problems coming on after organ problems as a secondary thing to any kind of, or the other way around. So it's an interesting comment that you noticed that there is a difference and it gets worse from walking far. But that's a good explanation. It's the fascia where the organ's hanging in that's affected and pulling on the muscles.
I love that because I was thinking, oh, that's not a good question for today because we've got Rikke here and we need to use her expertise and talk about topics that are, you know, but actually it's about fascia, even if for you, even though it doesn't, you know, I mean, that's so interesting.
That's fascinating.
Yeah, absolutely.
Fascinating.
Fascinating. Yeah.
So can I just add as well that generally speaking, Struvite crystals are the ones that are related to biome. A lot are to do with bacteria and biome. So because the microbiome did used to be only really measured in wee, so the metabolites of the wee before we had all the fancy stuff we have now. So definitely struvite is going to be linked to diet through the microbiome as well. And I also want to add, it may be that the SD comes in a tin, which appears to have more moisture in it, but believe me, it is nothing compared to a fresh diet. So it's kind of just wet kibble, really. So it's not going to be. You're not going to solve it by feeding the SD, even if it was in a tin, just to add that.
But it's also just seems a little bit, I'm not sure I'm not quite happy with that approach to just say, oh, that's blood, we don't know why, let's feed this. You know, we need to know what we're doing. We need to know what's wrong.
It sounds like that's one of the options, isn't it, alongside possibly ultrasound. So maybe you can come back and tell us how Layla is when you have the ultrasound, Sue. Let us know what it shows. Yeah.
I agree so much with Lise that we really need to have the diagnosis clear. Otherwise, we can't treat, not holistically and not conventionally. We really need the diagnosis. Yeah.
Yeah, and I think that's such an important point here. We almost shouldn't discuss any kind of treatment until we say, well, because the only thing we really know is blood in the urine, and that's a symptom. It's not a diagnosis.
The microclusters of struvites is a thing, hasn't it? That's been mentioned in the message.
But that could there were bacteria in the urine before the antibiotics, and that will cause struvite crystals to form. So we don't know if they were there before, we don't know if there were bacteria before, and we don't know whether there's some fundamental thing going wrong in the bladder. So I would absolutely go for the ultrasound now, and then, you know, feel free to come back and tell us what the ultrasound said, and then we can advise much more specifically. But that would be the right way around.
But also not forgetting the kidneys, like it might come from even further up.
Absolutely. Yes. And hydration is going to be important, whatever it is, because there's inflammation in the bladder. But we just want to know more. We want to know that we're treating the root of this problem and not just easing it and covering it.
Yeah. Okay. Shall I let's ask Paige's question about her sprocker. 5 years
What
old.
is a sprocker? Is it a Springer Cocker cross, or what's a sprocker?
Yes, it is. Yeah.
Okay.
So this female sprocker, I don't think we have her name. She has allergies since a pup. Bloods were done at 9 months to find out what she was allergic to. It doesn't then say what it was, but she has since been on Apoquel and Piriton. So that she's 5 now, so that's a good few years of those. Stopped them in August last year when it was changed for Zenrelia. Is that the new?
My heart just drops when someone mentions that. Yes, that's the one that we've talked about at length with Victoria.
That's on our YouTube channel page.
It's the new and improved Apoquel.
But obviously, the point was that the dogs are pretty much guinea pigs when they're on this to begin with. But if you have a look in our YouTube channel page, there's much more information. We're with Dr. Victoria when we talk about that. Okay, so her allergies were worse last year. So she was on prednisolone, I think is what she's maybe trying to write. So she was on steroids, which the page doesn't want to be giving anymore, basically. So she has been on grain-free fish food and has now switched to hydrolyzed food as she was experiencing colitis. So this poor dog's body is so inflamed in all different places, basically. She has lactulose with her food to help her digest this hydrolyzed food. So it's a lot about the food here, but they're just moving on. So mite allergy is one of the things that the dog is definitely allergic to. So in October, the inflammation really took a toll. She developed synovitis in her right shoulder, as well as thickened fascia, a locked thoracic lumbar joint, and left hip dysplasia. So lots going on there for you to be thinking about. She's been on gabapentin and paracetamol since these joint issues, and having Indiba treatment weekly at a dog physio's with physio exercises obviously as well. I mean, allergies getting worse despite cleaning her ears, getting her glands done. So she's having her anal glands done. She's still scooting. Smells of Doritos, bit of yeast there.
That's the yeast, isn't it?
Yeah. So anyway, she is concerned, of course. I mean, so 2 weeks ago, she did the biome for pets. So a sample has been sent to check this dog's microbiome. I think Carol will have an absolute field day when she sees this. I think this is going to be a dog. I would love to see it, but I suspect she's going to have very low diversity. I am at a loss and feel so sad. I expect you do. I mean, it is horrible to see your dog suffering. And this poor dog has gone from one to the
5
next.
years old. Yeah.
Yes.
I think any
Yeah.
question that mentions fascia in it has got to go straight to Rikke.
Yeah.
I think that's a
Agreed.
first, isn't it? I have
Yeah.
copied the whole question under this video, I hope, but it's teasing me a bit. It won't let me see I can see there's 18 comments, but I can't see 18 comments. So I hope that you can all see the question. I have posted it there.
I would say in this case, the fascia problems is just on top of the other, all that inflammation in the body. So that I wouldn't begin there. I think there would be other places that are more important to start with, and then I would expect a lot of the fascia problems to go away from controlling the inflammation. But I wouldn't start with the fascia only. That would not be the right place. Of course, you can support it treating the fascia, but it won't help until the inflammation has been dampened in that body.
I don't
What
know if we're
about
reading this question
fever?
right.
No, I think we are. What
But
about
if it sounds
Go
like
on.
this dog was put on Apoquel at 9 months old.
Yes,
Yeah,
yes.
It's not licensed for animals under a year. I mean, that's just off-license use of Apoquel. That's really worrying to put a 9-month-old dog on Apoquel and then has been on it for nearly 5 years, 4.5 years, and then changed to this Zenrelia, the new version. It's clearly a dog with a very messed up immune system. So it has to be homeopathy. You know, you have to look at supporting the immune system. You have to look at, I don't know how you vaccinate your dog, but that can certainly be something that can really provoke the immune system and exacerbate these sort of issues. And my first aim would be to get the immune system stronger, and if he's still on Zenrelia, to take it off. But I'm not sure he is, because it says end of August last year we changed from Apoquel to Zenrelia. Last year her allergies were the worst ever, so she was also on steroids. So it doesn't sound like the Zenrelia worked.
No, it doesn't.
And I can hear that Paige is concerned about the steroids. I'm much more concerned about Zenrelia. Obviously, we don't want someone to be on steroids for months or years, but we certainly don't want them to be on these other drugs either. And in that context, the prednisolone is the one that worries me the least. But I think if I'm to say one thing, it is don't give up. First of all, we're not blaming you anything. It's a real heart sink when you hear a story like this, where someone is put on these drugs so young and has been on them for so long. We're not blaming anyone. It's not hopeless. There is help to be had, and there's a lot of hope that your dog can recover, but don't try to do this on your own. You know, don't think that you can buy a supplement here or a supplement there, or put it together on your own. You need to commit to working with, I would definitely say, an experienced vet who does homeopathy, and then slowly but surely decrease the drugs and get her immune system sorted and get her back on her feet. I see it every day. It is possible. And you are not the only one that comes for help at a point where years and years down the line, it looks like everything is giving up because you've got side effects of drugs that are given because of side effects of drugs. And, you know, the whole vicious cycle has clearly been going for a while here. That doesn't mean it's hopeless. Gabapentin can be a problematic drug. Zenrelia is an utterly problematic drug. Apoquel is a problematic drug, but it can be walked back. You just need to be working with someone over months to get your dog's health back on track. If you tell us where we live, we can very happily try and refer you to someone. And if you're in the UK and you're looking for a homeopathic vet, BAHVS, British Association of Homeopathic Veterinary Surgeons.net. There's a full list of vets, so that would be a good place to start. But you need to work with someone, and there is a way out of all of that and out of those drugs.
100%. 100%. I mean, what will happen is you will have this report come back from where you've sent the stool to be tested for the biome, and brilliantly you have chosen the best lab in the UK. So you will have a very comprehensive report, which you will have a certain amount of time you normally get with the report lab, and usually they will chat you through the report and what that means. I don't know now how their system works, whether you don't get that now and you have to pay for a consult, but the result of this will be that the dog will be, depending on which biome is more prevalent or how the imbalance is presenting on the report, you will be offered one of a different set of prebiotics. So there's different sets of prebiotics as supplements. So they're different to probiotics page. Probiotics are the actual bacteria, the actual biome. These prebiotics are the plant compounds that this particular lab, and this is one of the reasons why they're the best in the country, have for decades, more than a decade, been researching in terms of how they correspond with the different bacteria types that you'll see on the report. So it'll be something like firmicutes, for instance. There'll be certain plant compounds that they know act on these bacteria to balance them. So I'm not saying not to have that supplement, but what I could potentially see happening here is a dog that has what we call gut dysbiosis, and I think it is vital that you work with someone rather than simply I do think you should give them whatever prebiotics come up, but I do think you need to be working with somebody. Now, Paige has told us that she lives in East Devon. Now, Vicky isn't working at the moment because she's had a baby.
She just had a second daughter.
Yeah, so that's a bit of a blow, because she would have been your closest holistic vet. Although I don't know if she does homeopathy, but she does lean into homeopathy quite often. So it may be that, yeah.
Oh no, she absolutely, yeah, she's a homeopath.
Right.
Yeah.
Well, it may be that you can, until Vicky is back practicing again. I don't know. We can't wait a year. I don't know how long that will be. We'll have to find you somebody to work with. I'm really keen to help you to find somebody to work with, even if that means you have to work online with somebody initially, and maybe then start with Vicky as soon as you can, because she's not far from. I'm in Devon too, and she's not far from us. So that. But ideally, you need to be working with someone. I would say you need to work with a professional nutrition consultant as well. I mean, it may be that Katie at the Pet Diet is the best place to start. So she was a vet nurse as well. And I suspect there's been bloods done at some point here. So that they would be worth showing. I don't know whether I would be even confident in how I feel until I saw the gut report, really, on your dog just doing one of these like switches onto raw, switches onto fresh. I think in this instance, it may be that we need to build something within the gut first to allow that transition to happen. I do think, obviously, that the dog needs to move onto fresh food in some way. It may be that this is a classic example of a dog that needs to have fresh cooked rather than going straight to raw. It may be the other way. I'd need to see the gut biome report to analyze the data and see what I think. But I would recommend that if you do accept whatever the prebiotic set is that you're offered, but I wouldn't then continue with that company if they're offering diet sheets. We are actually at the APNC liaising to create really fabulous diet sheets and diet consults with that company, and we're not at that stage yet. So I would say you need to work with someone who's a little bit more qualified in that. And I imagine there will be deficiencies. Potentially there will be zinc deficiencies. I mean, I could be speaking out of turn, and this is one of those dogs that you switch to fresh and just, it's like it's a domino effect, and the body goes, thank you, and everything starts to correct itself. But I would just proceed with caution on that front. And maybe homeopathy starts to make some shifts and changes as well, so that the diet is better accepted. But I would imagine your dog has quite an inflamed gut there. It's not going to be the easiest dog to transition, but definitely needs to happen.
And it's just an example of, I think, where we have to see different ways in. You know, I mean, I would I mean, I just think you need to see a vet who is really experienced
hope
in
they have it
weaning
there.
animals off these drugs,
Well, a
because you
vet that
have
can do the nutrition lease as well would be ideal, wouldn't it, really?
Sure. I mean, that's what I mean. It's not where I would start at all, but it's just an
But
an example that when you have a system that's in a vicious it's a vicious cycle, that you can approach it from different places and end up getting a good result. My concern would definitely be that this is a very severely immunocompromised dog. It was initially, in terms of the whole allergic issue, but much more so now. If it's still on Zenrelia, I would even possibly worry a little bit about putting this dog on raw, because this dog doesn't have an immune system that can cope with much. So I think strengthening the immune system first, then getting them off the drugs, and then looking to improve the diet would be my way. But there are several different ways in. That was my point, that you can approach it from different angles. But yeah, sure. But my overall message to Paige would be, don't try to be in charge of this yourself, because it's not possible. You know, there are some areas that are perfect for home treatment, and there are some areas that are just absolutely not. And this is not only a complicated case, it's a complicated case on lots of medications that's been going on for nearly 5 years. So it needs to be walked back slowly and with a lot of care and expertise.
Yeah. 100%. I think that because Paige has already gone down the road of biome test, I could just see what was going to happen next. And I think it's vital that you work with the homeopath. Absolutely vital.
And I think Rikke is right that you know, the inflammations in the joints is just an example of how everything is falling apart, really.
Yeah.
This is it.
And then you get into the spin where you add more drugs. It's hard to see how it's going to end well unless you really get someone to help you turn it around. And then I promise you it can end well. It just needs, you need help. You definitely need help.
Okay, yeah, Fiona's making the point that we don't really, well, she's saying we don't particularly know what a good biome would look like, a good raw-fed dog biome, because perhaps you mean we don't see that many of them, and we're waiting still for a bit more research and a bit more science. I mean, Carol's data is pretty awesome. I mean, I think we could possibly even ask her to sort of go as far as to say what she would like to see and what she does see in raw-fed dogs at the next expo. So that it's something to aim for, isn't it, with our dogs? But the thing is, the dog's gut is so, to use her word, volatile, that it shifts and changes so much depending on the environment, the farming practices around us, and all the different things that are going on in the world. I don't know whether it would, even if we had a pattern of what we felt was a really good biome, whether that would correlate them into other dogs. I think what we do know is which biome tend to proliferate in certain, when the dog's got certain ailments, and which biome tend to, well, the relationship between the biome and certain ailments, whichever came first. We definitely do know that. So
they're really interesting questions, and really, yeah, very, very interesting questions.
Fiona's saying Carol's data does not have diet specific info. She says it does not exist. That's not what she tells us. So either she's not prepared to put it out into the wider, it's definitely conversations we have with her in the APNC. I mean, she was really open about what the insect food showed, and that she had watched, I can't remember the exact term now, but it's along the lines of strange or something like that, odd bacteria that she's not seen before from these insects. Anyway, we only have a few minutes and we have Rikke with us. I feel we should.
Rikke, tell us about your week. What's been your most interesting patient? Let's
Yeah, it actually comes back to some of the things you already said, that very often the patients that I see are quite complicated. And I cannot go only with one modality and solve the problems. I have to combine my acupuncture, my osteopathy, homeopathy, craniosacral to get these patients going again. So we should not simplify things and think we only have to go one way. We need to, and I try to use all my modalities very broad. And I had a couple of patients that they came for acupuncture and osteopathy, but I would not have solved them without also adding on homeopathy. So I saw a couple of them like second, third and fourth time this week. And I'm certain that the way I used the homeopathy in these two cases was to lower their sympathetic stress level. And because I could lower that, their body got better. So one was a mare that was super distressed. She was always looking out. She was so afraid at New Year. She would be afraid of coming into a competition area like indoor arena where there was a lot of noise. And so she got tense in her body. And if I had not been able to lower her stress level with the homeopathy, I would not have got her body better. So my message is that sometimes we need to look at more modalities and again, where do we start? That's a difficult thing. What modality do we start with? And for me, I'm so happy that I have more modalities to choose from. Because as an owner, it can be really hard to know, should I go to Lise or should I go to an acupuncturist? Where do I start? And I think the main thing for me is if we can come in whatever way it is and lower the sympathetic arousal or arousal response, then we can get a healing going. And then for some individuals, it would be acupuncture. For others, it would be homeopathy. For humans, it might be colors or sounds. It's just to find the open gate where we can get in, and then we can maybe add on more modalities. But for me, that's how I see a case. It's like a jigsaw that I need to see where do we have the opening that I can get this thing going.
But do you also think that in some patients, it could be either? Some patients, if they go to an acupuncturist, it's going to be sorted out that way. And if they go to a homeopath, it's going to get sorted out that way. You know, sometimes there's more than one way in this. I'm sure some have an affinity for one treatment form rather than others, but some are also just able to respond to in multiple ways, I'm sure.
That's the thing. Some will respond on whatever you do, and some you really need to find the right opening to get into it. And that's what makes it difficult, but also interesting for us.
Yeah,
like,
of course.
Not the owner doesn't think that it's interesting cases, but for us it is.
Yeah.
So I had a couple of those, and that's so satisfying when people come and say how much they have changed the animals. And then you're on the right track. You might not be all through the problems, but you are on the right track. And then you change that vicious circle to a good circle, and then they will, like you said before, Caroline, then all of a sudden they recover for so many things.
And you know what's interesting? Of course, human nature, we want to go for the last treatment type they had and say that's what worked, but it probably was happening in layers.
Definitely. Really, I really see that the onion as an onion, and you peel off the layers and you start at one point and then you end up with something you didn't expect because you could not see it because there was so much on top of it. So, and that's why you should not give up. And of course we can say that you might have used a lot of money as an animal owner, but there are more ways to do it. And sometimes you just have to search a little bit to find the right way.
But that's also why you need to be guided. You need to work with someone who's done it 1,000 times before, and who knows the signs and who knows the time frame. And it's not something that you can sort out yourself, but nor is it something that's impossible. And I imagine that you're not that far away from your conventional vet maybe suggesting that it's hopeless, but it's not. And I mean, I want that on a t-shirt still. Never accept that it's hopeless unless you've tried other tools, other treatments, you know, unless you've tried homeopathy, but it could also say acupuncture or whatever, then you can't know that it's hopeless.
No.
When someone says it's hopeless, they just mean with the tools that they have.
Exactly. And that's what conventional medicine does. That if they can't solve it with drugs or surgery, then it's hopeless, but or chronic or whatever word is used. But I really don't agree to that.
Exactly. Yeah, that's a good note to end on. There's lots of hope, and there's lots of things to do and ways to go.
Yeah, and there are so many vets now. It's like so many more vets now offering different modalities that there was 30 years ago. So it's easier now than it used to be.
Oh, absolutely. Yes. Good. That's our time. Thank you, Rikke. Rikke is going to be at the expo in April. We're all going to be at the expo in April.
And that's what I'm going to talk about, my myofascial kinetic lines on dogs. And I want to tape some of these lines for you and explain how the body works and what these lines do if they are too contracted. So what are the symptoms? Here there would be a rotation, extension of the back, and what does that do to the dogs? So and lots more.
Yes, we will all be taping teddy bears of dogs.
Yes,
this is a big announcement I've yet to make.
That will make for some excellent photos.
I'm bringing the tape. You bring the teddy bears.
It's the teddy bear picnic. Yeah.
The teddy bear picnic.
Cool.
Okay. Thank you very much, Rikke. Nice to see you, everybody.
For having me.
See you next week. Bye.